According to the Cystic Fibrosis Foundation, roughly 1,000 new cases of cystic fibrosis are diagnosed each year. More than 75% of people are diagnosed by age 2. Our Cassidy Fury spoke with a pulmonary and critical care doctor to learn more about the disease and how people who are diagnosed manage living with the illness.
The Cystic Fibrosis Foundation reports that nearly 40,000 people in the United States are diagnosed with cystic fibrosis.
Right now, cystic fibrosis is not curable. It's a lifelong disease. It's a full-time job to be a CF patient, even in the world of modulator therapy.
Dr. Michelle Jones, pulmonary and critical care attending at WVU Medicine's Camden Clark, said the life expectancy for someone with the disease has gone from early 20s to 40s and 50s in the past 10 years.
And the new modulator therapies have radically improved patients' quality of life, too. I've had patients say that these are life-changing drugs.
Cystic fibrosis affects your lungs, pancreas, sinuses, and digestive system, as well as making a patient susceptible to infections.
You know, we try as much as we can to keep these patients out of the hospital. So we try to do as much as we can at home because they are so susceptible to respiratory infections. And in the hospital, you can pick one up.
Dr. Jones said living with cystic fibrosis is both physically and mentally taxing on patients.
So this is one of the most difficult things for cystic fibrosis patients to deal with. You have to show up and treat your disease every single day.
The diagnosis may come as a shock, especially to mothers who had a normal pregnancy and a healthy delivery.
Helping them find support is extremely important, and telling them, hey, this isn't rare. There's a lot of people who have this out there, and getting them connected with support groups and things like that. And then you kind of fall into a new normal.
New modulator therapy methods have given patients who respond well to the drugs a new lease on life, Dr. Jones said.
Well, I think that the most important thing is realizing that these are people just like us who can absolutely go live very normal lives. We do have to be mindful that they are at increased risk of infection. So if they, ask you to wear a mask or wash your hands or delay a visit because you're sick or they're sick, really important to respect that.
While there is no known cure for the disease, Dr. Jones hopes that with the strides in treatment made in the past decade, we are closer to a cure now than ever before. Reporting from Parkersburg, I'm Cassidy Fury with WTAP News.